My name is Philip Abdelmalek, and I lead a unit called Intelligence, Innovation, and Integration at WHO. That's the unit that hosts and leads the EIOS initiative. The EIOS initiative, for those who may not be very familiar with it, is an initiative that is being led by WHO. It's a global collaboration that looks at how we build and strengthen public health intelligence capacity from the subnational up to the global level. When we talk about public health intelligence, we're really talking about how do we improve the detection, verification, analysis, assessment, and communication around potential or occurring public health threats so that we can mitigate their impact on lives and livelihoods or prevent that impact completely. So with that, a little bit of a background, I'm really pleased to welcome you all to this speaker session. The speaker series was started by the WHO Hub for Pandemic and Epidemic Intelligence, with the first session being held in July earlier this year. So this is the third session and final session for this year. And we're going to be looking at this session at innovations for technology. So using technology in the context of the broader theme of the speaker series, which is around complexity of pandemics. And one question that might come to mind, perhaps, maybe not, is what do we mean when we say the complexity of pandemics? And so I'm delighted this evening or afternoon or morning, depending on where you're joining us from, to mention that this is exactly part of what we're going to be talking about today. And I'm following up a presentation on complexity with some discussions and presentations and discussion on this innovations using technology. So before I get into introducing who the speakers are going to be and we jump right into this, I first want to acknowledge the person who's been organizing a lot of these speaker sessions and putting a lot of effort into getting them together, and that's Isabel, who's sitting in the front here. So thank you very much. First, we're going to hear a little bit from our Assistant Director General for our division, which is the Health Emergencies Surveillance, Intelligence and Surveillance Systems Division, Dr. Chikwe Igwezu, and he's also the lead of the WHO Pandemic Hub, or Hub for Pandemic and Epidemic Intelligence, which sits within that division. And he'll set the scene by describing a little bit what we mean when we talk about leveraging technology. Our keynote speaker will be Professor Dirk Rockman, and he'll speak on the relevance of applying complexity science and explain what we mean when we talk about complex systems, and looking through that lens to help us then prepare for some of the next discussions in terms of innovations for intelligence. That will be followed by a couple of presentations, one from Dr. Nada Rosen, who will share impressions from Lebanon, coming from the Ministry of Health, and also Mercy Kim, who will share with us right here some of her impressions as well, coming from Africa CDC. All of this will then be followed by an open discussion. And so we really want to encourage you to pose questions to the panel that will then be sitting up here, made up of Dr. Rockman, Mercy, and Nada. And please do send your questions. You will have all found, I think, on your chairs a little flyer. On the back of that flyer, there's a QR code which you can use to send your questions. Dr. Oliver Morgan will be helping me with this, helping to triage questions. So if your question is no good, you won't hear it. But obviously, we can't take every question that comes. So we'll do our best to answer or pose as many questions to the panel. The more difficult the question, the better. So please do send your questions in, and we'll hopefully have a lively discussion. So with that, we're going to move on. I'm going to invite Dr. Chikwe up to set the scene and talk about innovations.
Thanks, Philip. And for those in the room, sorry you're hearing me for the third time today. But we do have a very broad audience online, and very grateful for all of you that have joined us. The theme of this series, the complexity of pandemics, has really taken us on a journey. And each of those previous talks have really influence how we think about our work and the challenges that we will have moving forward. We started with a session on One Health, on the animal-human interface, and how data from that whole space will influence the work we have. We went into a second session on social sciences and behavioral data learning from the pandemic, and how that is completely changing how we view our work in making public health decisions. And this third one, linked to this event holding here in Luxor, will again probably change how we're thinking, and has already started doing so through the sessions this morning, the fascinating sessions on decision making, on trust, and everything else around that. And I really look forward to the incredible panel that we have and the thoughts that they will be sharing with us. My name is Chikwe Ihekwazura. I lead a new division for surveillance and health emergency intelligence systems. The word systems is actually a very important part of our name, because the actual intelligence work for the day-to-day verification, detection, verification, and response is still done by our colleagues in Geneva. And what we are doing in the new division, which actually crosses across a small department in Geneva, a third of our division is in Geneva, 2/3 in Berlin, is to support the development, innovation, thinking around systems, adopting them, and all the other things around governance, technology, and human resources needed for that. To get us going in thinking about pandemics and epidemics and how innovation and technology will influence and affect the future of how we're thinking. We've all witnessed the incredible innovation and research that has happened, and maybe the biggest story out of in this space through the pandemic has been what has happened through to the development of vaccines. When I started my career, my first public health job was 2002 at the Robert Koch Institute. I remember being there, listening, not really participating, but being present as colleagues responded to the first SARS epidemic at the time. And I remember the celebration around the world when the first genome was categorized and defined 3 months after the outbreak had started. And this time it happened literally in days. In 14 days we had a PCR test, and in 11 months we had a vaccine. So this in a way is the story around research and innovation, the biggest story for this pandemic. But behind that has been a lot more, from how to get information to how we're making sense of it, how to convey these insights, and how to spread expertise. And this is really what we'll be thinking and talking about today. So we've seen all the various innovations around data, automating data collection from the web, crowdsourcing data, and new terms I learned, especially from my friend Dushan, if he's not in the room today, on taxonomies and ontologies. And very interesting new terms being introduced into the whole public health arena that many of us would not have been confronted with many years as we through the years of practicing. But we've also seen new opportunities to develop new models, to do scenario modeling, and really try and use some of the data we've collected to think about the future and to predict the future, to understand where we are. We've also seen the evolution of new dashboards around the world. Almost every institution has a new dashboard, a new way of displaying data, and some of these have even grown into being very popular and being the go-to sites. If you think about the work Johns Hopkins has done and our world in data, publicly available public dashboards that we ourselves as public health decision makers use to look at the data of what is going on in our own countries. If anyone in this room hasn't done so, I'll be surprised. But really, it's just an example of how much this space has changed. But it's not only through the anecdotes, right? Most of us are scientists, so we want to look at what has evolved in a specific subject area, we go to PubMed, we do a search. And basically what we've also found is just the amount of research that has gone into understanding this space in the last few years has just been incredible. So there have been more papers published on methods, on new technologies, tools in surveillance and epidemic intelligence in the last 2 years that have been published in the last 10 years put together. So this really demonstrates the amount of effort, energy, and science coming out of this space. So it's not for a lack of innovation, it's not for a lack of thinking. Colleagues around the world are pushing very hard in these topics, innovating and finding new ways to look at and understand the data that we have, find new ways of analyzing that data and using it for decision making. But we go to PubMed, other people go to other places. So one very important repository for new algorithms and codes, open source, is GitHub. And what we've also seen in the last few years is an incredible number of new repositories on GitHub, all associated with the COVID-19 pandemic. Over 200,000 in the last 2 years. So you cannot imagine that all of these are public health professionals. So we can't have so many people working on new algorithms for public health intelligence. The truth is they're not. So these are colleagues that were working in industry, in pharmaceuticals, in security, wherever else they've developed that expertise. But in the last 2 years, they brought that expertise into our space. They came together and said, listen, the biggest challenge of our time is this pandemic we're facing. So why don't we use the expertise that we have to solve some of the hardest problems of our time? So this is an incredible opportunity for all of us to think. It's not for a lack of innovation, it's not for a lack of research. So the challenge now really is, how do we arrive at some consensus on what is needed? For sure, not all of those 200,000 repositions on GitHub will be necessary. Not all of them would we need for the future. But we have to come to a way of making decisions on what we need in our space. And whatever that method is, we have to think about it. Because in a lot of other spaces, whether it's around pharmaceuticals or diagnostics, there are processes where the best methods rise to the top. And methods through which consensus is arrived at within communities of practice on what is the best approach to certain problems. And we don't have a method yet of reaching that type of consensus. And whatever the approach is, and how much it is regulated or not, is something we will have to think about how to do. EIOS is a good example of a bit of an exception where there has been a growing consensus on how to do epidemic intelligence. And at the moment, the demand for this community, this platform, by far outstrips our ability to deliver on it globally. And that demand will keep increasing as there's more demand at the sub-national levels. But at the same time, there's so many opportunities for tools in so many different aspects of how we work that we need to find ways to efficiently manage and curate this space so that the very best rises to the top. And we are more efficient in using the knowledge, the opportunities, the different circumstances that we have in different parts of the world to contributing to this. And this is one of the real challenges and opportunities that we have set for ourselves at the new WHO Hub for Pandemic and Epidemic Intelligence. We're not coming to this from the point of view that we have the answers to any of the questions. We're not even coming to it from the point of view that we should have the answer or that we're building up to the answer. What we're offering this community is an opportunity to curate this space, to work with you, to invite you in and allow us to come into your spaces, and maybe together we can find a way of offering the world a way to reach efficiency in the tools we need, in the technologies we need, and how to build the communities that will co-create all of this. So in the three sessions and colleagues that will share their thoughts with you in a few minutes, they will approach this from different perspectives. At the end of the day, we won't have all the answers, but at least I hope we'll have set ourselves in a direction of travel through which hopefully we'll come back in a few years' time and define this moment as one of the defining moments as we started the journey to defining how we move the incredible research, innovation, new tools, ideas that have evolved over the last few years to some consensus of, around emergency health intelligence, the systems, and how we use that to arrive at public health decisions.
Thank you very much, Chikwe. And as Chikwe mentioned, and we saw in the GitHub slide, Chikwe talked about how COVID-19 pandemic has really catalyzed, bringing together a lot of different expertise, different domains together. And so that, in large part, has to do with complexity. And so as we get into that, and just before I invite Dr. Brockman to come up, I want to tell you a little bit about him. So Professor Brockman is a professor in the Department of Biology at Humboldt University in Berlin. And he also heads a computational epidemiology group at the Robert Koch Institute. He's a complexity scientist at heart and a theoretical physicist by training. So that's great to have that sort of background and domain here with us. He's had over a couple of decades, which makes him sound really old when you say that, years of interdisciplinary research experience working on fields as diverse as neuroscience, network science, infectious disease dynamics, and collective behavior in human and animal populations. And he and his team in their research are approaching complex phenomena on the interface of life sciences, social sciences, medical sciences, using an integrative approach of computational methods, network science, and data science. So with that, I want to invite Dr. Brockman to come up. And thank you so much for being here with us.
Thank you very much, Philip. It's really a pleasure being here and speaking in a series that is called Complexity of Pandemics. When I first heard about the series, I was super excited for two reasons. A, because I'm a complex systems scientist, so I was very happy that the term complexity made it into a pandemic topic. And second, because for the last years and decades, actually, I've been trying to promote complexity science as a scientific field into various other areas. So today, I'm going to talk a little bit about complexity science. Now, there's a little bit of a problem with complexity as a term, because all of us think about different things when we hear complexity. It's very vague. Sometimes that's an advantage, but sometimes it isn't. So the first mistake that you can make is confusing a complex system with a complicated system. Like, for instance, a mechanical watch. It's very complicated inside. Very many moving parts. But at the end of the day, it's just, producing periodic motion at a constant speed. That's a complicated system, not a complex system. On the other hand, if you have a rolling die, it's very simple, right? A rolling die is very funny because it produces a random result. But the physics, the equations of motion, you can write them down on a napkin. They're very simple. That's an example of a complex system. Very simple rules generate very complicated behavior. Which brings me to the next slide, the scientific field of complexity. Now, about 2 decades ago, when the century turned, a very famous theoretical physicist, Stephen Hawking, was interviewed in a long interview, and the journalist asked, or he said, look, the 20th century was the century of physics, theoretical physics. We had relativity, quantum mechanics, quantum field theory, string theory, the Higgs boson, all that great stuff. What's going to be the next century? And Stephen Hawking said, I think the next century will be the century of complexity. And when you read the interview, it becomes very clear that there was one central message. And that message was breach boundaries and crossing limits on various levels. So Hawking meant that we're going to focus on phenomena that don't occur in one traditional scientific discipline. We're going to focus on phenomena that go across scientific disciplines. Plus, he was also saying that in the way we look at these systems, we are going to also have to use approaches that go beyond traditional disciplines. So let me focus on phenomena first. Let me just make a comparison here between the pandemic and climate change. Now, on a very simplistic level, you can say, okay, we have climate change, that's just the emission of greenhouse gases, it heats up the earth, etc. And then we have a pandemic, and a very simple description, it's transmitting a virus from person to person, and that goes on forever, or for a long time. So very different systems in a sense. One common factor is that they also don't respect boundaries. They're global phenomena. But the most defining feature of both of these phenomena are that we decide how they pan out. We are part of the equation, which makes it a complex phenomenon. In fact, when you look at it a bit closer and you simplify even that kind of feedback, you can say, okay, maybe in the pandemic, we see case counts rising, we get information about it, that does something to our brain, we think about it, psychology plays a role, that changes our behavior, that in turn changes how the pandemic unfolds, and so forth. So we have a feedback loop. Feedback loops are everywhere in natural systems, particularly in biological systems. They're there for regulation, for instance. But they also are intrinsically unstable sometimes. But what's important about these two phenomena, the climate catastrophe and the pandemic, is that these feedback loops occur across different scientific disciplines. So it makes no sense whatsoever to take the phenomenon, cut it into pieces, and let the virologist take this piece, and the epidemiologist this piece, the psychologist this piece, the behavior scientist this piece, and then look at that and not talking to the other people. That makes no sense if you have, or it's inadequate, I should say. I think it makes no sense. But if you have a feedback dynamical system that spans these disciplines. And so when you look at complexity science, which is actually quite old, about, say, the 70s, it goes back further, it is a scientific field, but one without boundaries. The main, at the core, at the heart of complexity science is connecting different disciplines. For instance, going into ecology and looking at ecological networks and investigating their structure. And then going into economics and investigating the structure of transactions between investment banks. And then asking, maybe natural systems, they're very robust and very resilient, maybe I can learn something about how I structure investment banks in a resilient and sustainable way. Or seeing that, going from physics into social science, that actually goes back almost 100 years. And so that's kind of the spirit of complexity science. But why? And it's 50, 60 years old as a discipline. But why did Hawking say this century is going to be the century of complexity science? He understood that there are technological revolutions that profoundly change the way we do science. We all have, almost all of us have this instrument on the left. That means, to a good approximation, we have access to all the information that exists. To a good approximation. Which is why companies that help you find information make billionaires. That's one of the revolutions. Then there's network science. You see this network there in the center. It's also a scientific field which it doesn't belong to physics, to math, to computer science, to biology. It doesn't belong anywhere. Nevertheless, it's a science. And it kind of started also at the turn of the century and it increased exponentially in terms of the scientific papers that were published. This network that you see here is a network of the most cited papers in network science. They were published in a traditional field, like say in physics or life sciences, and the links exist between, these links mean citations of other network science papers in other fields. And you can see this network and it doesn't have any boundaries. It doesn't make sense to draw any lines. It's just a connective tissue of traditional disciplines. And then we have the power of computers nowadays that enable us to investigate dynamical systems that were interesting 70 years ago, but no one could investigate them because of the lack of computational power. So these three things can become data science, dynamical system science, network science, can become sort of part of, or are a part of complexity science, and they can become a connective tissue, a glue that connects these elements, medical science, life sciences, and social sciences that play a role in these big phenomena that occur across these disciplines. So what's important in terms of teaching, and it's always on my agenda, a while back, these things that you see in the middle, they have been associated with, say, computer science. So social scientists would think, oh, that's, computer science, or physics, or whatever. But these things have to become a part of these traditional disciplines. They have to be incorporated into the training so that when people from medical science, social science, and life science, they come together, they know what kind of methods the others are using. They're speaking the same language. And why? Why is that good? Because it helps us see things that were previously hidden. That's all everything is about. So let me explain this to you by just giving you one example. Let's look at the pandemic again, and look at this network. This is the Worldwide Air Transportation Network. I'm sure many of you have seen a picture like this. And it's not only there to illustrate how much we travel and are connected. It's about 14 billion kilometers every day is what mankind travels. That's 3 times the radius of our solar system. A lot of traffic. But just by looking at the picture, you can already, and you can show this actually in a computer, but you can already see that travel restrictions, at best, can delay something. They're not going to contain anything. You just have to look at the picture. But what's important about this network is that this web is very complicated, and the complication in this network leads to a dynamic that looks very random, like you see in the video, which is the actual dynamic of the pandemic over a long period of time. So what could we do using complexity science? The one trick, it's just one story that I have time for, is changing our perspective. Just as a toy example, let's pretend we are the virus. You are a virus on a host that is a traveler at JFK Airport in New York. Now, there are places that are very far away, but lots of people travel there. Places that are close, few people travel there. From the perspective of the virus, that distance doesn't matter. All that matters is the probability, how many people go from A to B. So effectively, New York is much closer to, say, European airports or other airports. Just a toy example. Now, what happens if you do this kind of effective distance approach on a global scale? Here's a little video. This is the traditional way of looking at things. And now, what I'm going to do, or the video is going to do for me, is going to change this perspective. The perspective, in this case, is Wuhan. Now Wuhan is in the middle, and this radial distance is this effective distance, and immediately you see the big hubs in Europe are much closer. And you could use this in order to get a good intuition about the spreading routes of a new emergent variant, for instance. Now, is this just a toy? No, it isn't. Here are 2 computer simulations of hypothetical pandemics with some arbitrary starting points. And on the right, you see a computer simulation in the traditional picture, and on the left, you see the exact same simulation in this effective distance that is more sort of the virus perspective. And everything that looks very complicated on the right becomes regular on the left. That's also just an academic insight, but it isn't. Because you can use this information in order to compute arrival times, expected arrival times, or import probabilities. And that is something we actually applied in the early phase of the pandemic. So that's it. I have a bit more to tell you, but I was given the 2-minute sign. Where's my timer? Where did she go? Oh, okay, she gave up. So I'm going to stop right here. I was going to tell you about this project also, the data donation project, which is about breaching the boundary between science and the public. But you can just scan the barcode and get your information there. Thank you very much for your attention.
Great, thank you very much, Dr. Brockman, for explaining the concept of complexity and how it's different than complicated. And also, I'm just going to maybe pick up on what you said at the end, perspective matters. And so now we're going to switch gears a little bit and get a different perspective. Not quite what you meant, but we'll get a different perspective. I'm going to invite our next speaker up. We're in a room today, so for those of you online, I think I didn't quite mention at the beginning that this is a special speaker series that's being held in conjunction with this year's EIOS Global Technical Meeting. I did talk at the beginning about what EIOS is. And so in the room here, we've got a lot of experts, professionals from the public health intelligence domain, but also collaborators who sort of work in this area. And so it's great that we've got some of these different domains coming together. And what I want to do, or what we would like to do next, is actually bring from the public health intelligence perspective what some of the observations have been in terms of innovations in technology. And given the context here at the EIOS Global Technical Meeting, I think you'll see that there's a lot of reference to that, which is fine because here in the room you can relate to that, and online you don't learn a little bit more about EIOS and have an opportunity to ask questions and comment later. So with that, I want to introduce Dr. Nada Rosen, who's going to come up in just 1 second after I give a brief bio. So Dr. Rosen has been the head of the Epidemiological Surveillance Program at the Lebanese Ministry of Public Health since July 2000. That's perhaps a softer way of saying more than 2 decades, where she works to enhance communicable diseases surveillance systems, build national capacity for disease surveillance and outbreak investigation. And since 2004, she's also been contributing to the Mediterranean Program for Intervention Epidemiology Training, MEDIET, which is the FET for the Mediterranean. And that's because the site where she works is designated as well as a training site. Since 2020, she's been leading the Lebanese national team that's been in charge of COVID-19 surveillance and investigation. And this year, she's also been leading the surveillance investigation of the cholera outbreak in Lebanon. Dr. Rosen is also a lecturer, or has been a lecturer in the Faculty of Public Health at the Lebanese University, teaching epidemiology and epidemiological surveillance since 2008. Thank you very much for joining us, Dr. Rosen. The stage is yours.
So good afternoon. It's a pleasure for me to present about the Lebanese experience regarding the EIOS, and I will start with my presentation. So as you know that for the health security and global security, countries have to work about event-based surveillance. Event-based surveillance is a mechanism where we collect data from different sources, different structures in order to detect any alerts with the public health consequences. In this event-based surveillance, we have different components. In Lebanon, we have the call center where public can call to report about an alert. Also, we have the community-based surveillance where NGOs and municipalities can call the ministry to report about alerts. And also we had the search engines about online reporting, online journals, and also the search about social media. For the search on the online published data, we are using the EIOS, which is the Epidemic Intelligence for Open Sources. And what was said is a network of networks and systems where we want to collect and to verify and to assess and communicate about alerts from different published online journals or articles. And here I will continue. So with this EIOS, we have different steps. And in Lebanon, we are using EIOS since March 2022 with a scope of national scope. We don't look to the regional, even the international, unless we have consequences on Lebanon. So we have started since March 2022, and we have these different steps where we have goals identified with the criteria to capture the articles, and then articles are selected based on criteria, and then these signals are verified, so through our team at different levels or by partners, and then these signals once verified, so they are events, and then they are assessed for the potential threat for the human or animal health, so they are alerts. And then we have documentation and communication, so we can have action regarding this alert. And here we see the different points. These are the steps that we use for event-based surveillance, from detection to selection to verification to assessment and response. I will continue with the use of EIOS in Lebanon in action. So since week 13 of this year up to week 46, we have on average on a weekly basis around 900 articles captured by the EIOS regarding our goals that we have set. And also we have around 15 articles filtered, selected to be verified and also considered for later stages. And if you look to the new articles that we have since during this same period, 29% are from national scope. The others are from regional or international scope, but we may have some consequences in Lebanon. So usually in EIOS, we are capturing a lot from regional and international scope. I will talk about two examples of how using EIOS in Lebanon. And I will take the first example, how an online article will come to the ministry and to lead to action. So this is a contribution of the community to this epidemic intelligence and how to lead to action. It's about rabies. You know, for rabies exposure, if you have been bitten or scratched by a dog, you have to be assessed and taken vaccination and immunoglobulin to prevent to have the rabies disease. Rabies disease is fatal. So we can intervene before onset. We have to intervene before having the symptoms. So from this EIOS, we have captured, and it's not one time, several times, about articles from local journals that we have rabies exposure. People have been bitten by dogs. So here we take this information as a signal and then verify as an event and then assess as a potential threat for the life of the case. And we call the case to ensure that they are taking the adequate prophylaxis, meaning vaccination and immunoglobulin to prevent the rabies disease. This is an example where an online reporting to the community can lead to action to the page. The other example is different. We talk about birds, pelicans. You know, pelicans, they go through continents. They have migrations, and they have migration from Africa to Europe and then to Europe to Africa. And we have different pathways through the Mediterranean region. One of them is Lebanon. So we have heard and we have captured through EIOS that there is an outbreak of pelicans with H5N1 and was H5N1 in Greece. Lebanon, we don't have H5N1 yet. It's not endemic in Lebanon. It's in other countries, but not in Lebanon. So we have captured this article. It was selected, filtered, verified, and it was the Dalmatian pelicans in Greece. And also it was considered as a threat, as an alert, because we can have, if passing through Lebanon, to infect our domestic birds and poultry birds and then human also. So we need to have more assessment of this. And here we have contacted ornithologists and bird watchers who contribute to us to say that this is not the case because we don't have Dalmatian pelicans in Lebanon. From our daily work with the EIOS, we have some needs pointed out. The first one that EIOS usually catch data that is on online website. We don't capture what is on social media. And here we have the need to explore how to have entrance where we can search and capture and use from the social media, whatever was the source or the channel. And also the other needs about data management tools. Usually in our daily meeting for the EIOS, we have two screens. One screen where we have the EIOS screen with the different articles, and the other screen is about our data management where we put our documentation of the alert. So here we need to have some linkage to link them this in an automatic way where our EIOS can talk with a database, whatever was a database, and so we can have documentation of the alerts and also generation of indicators. We need to monitor our performance indicators, because this is a way to maintain our resources. Finally, EIOS is a tool where we can have timely detection of information once shared. And this is based on a teamwork. Teamwork where we have the national team involved, the regional team involved, and the global team involved. And here I want to thank my team, Ryan, the team, May, and Aya, and also the team from the office. Thank you very much.
Thank you very much, Dr. Rosen. I was fascinated by the Pelican handler. I think just there's a little bit of that crossover in terms of looking at different domains and the spread of pathogens. We just heard a little bit from more the national perspective. And so now we will move more to a regional perspective. In just a minute, I'm going to invite Mercy to come up. But again, before I do that, I'm going to tell you a little bit about Mercy. She's an epidemiologist with over 10 years of experience in strengthening health systems to detect and rapidly respond to public health threats at the national, regional, and continental levels. She currently leads the event-based surveillance program of the Africa CDC, and that's supporting the establishment of early warning systems to improve the early detection and reporting of public health threats. Prior to joining Africa CDC, Mercy served as Executive Director for Value Health Africa, where she developed and coordinated projects on non-communicable diseases and sexual and reproductive health, impacting over 20 communities in Cameroon. She holds a master's degree in public health and ethics from the Catholic University of Central Africa. And with that, I'm going to invite Mercy to come up. Thank you so much again, Mercy, for being here.
Good afternoon again, colleagues. As initially introduced, I work with the Africa Centers for Disease Control. Just so we are all on the same page with what Africa CDC is, we are a technical, specialized technical agency, and our work is focused around improving the capacity for national public health institutes, ministries of health, and other equivalent agencies within member states to be able to detect and respond promptly to public health threats. So in order to attain this, the Africa CDC established a functional event-based surveillance unit within the Surveillance and Disease Intelligence Division. And this unit is focused on achieving 3 or 4 main things that I'm just going to share with you quickly. So basically, this unit is developing guidelines, training models, frameworks, and tools, deploying these to countries to help them operationalize event-based surveillance. We are also training and building capacity for national and sub-national surveillance teams on event-based surveillance using the One Health approach. And we are also establishing technical working groups in countries, and also establishing community of practice at the regional level, just so that we give an opportunity for countries to share best practices, lessons learned, and also support them in some cross-pollination programs and build capacity on the continent. Lastly, but also very importantly, and this is what really aligns to this conversation this afternoon, is the development and the deployment of digital solutions to countries to help them in managing the epidemic intelligence processes. Before we go into a deep dive around what we've been able to do around that space, allow me to share with you a quick scenario. This is a scenario of a case, say in the country A dies and has a contact, and the contact eventually becomes asymptomatic. but has a flight to catch to another country, say country B, decides to self-medicate, maybe takes an antipyretic to relieve himself of the fever, goes through the point of entry undetected and finds himself in country B. This is something that we can all align to, and I think this is what's happening on a daily basis. Ideally, in a world where everything is equal, we expect that the thermal scanners at the point of entry will detect any symptomatic case. But because this case self-medicated, it will definitely go through the POE undetected and definitely find itself in the next country. And again, this reveals the complexity around how humans behave during situations like this. And as Africa CDC, we have actually understood that without collaborative efforts, without building epidemic intelligence systems, using the cross-border perspective approach, we definitely will not be able to pick up events like this. And we have also realized that there is need for us as Africa CDC to span beyond just the traditional methodologies, to span beyond the traditional technology, and also to start looking at other innovative approach, not just within the technology space, but looking at how to bring communities together and share information within those communities and able to be able to detect within communities. So it's not only the technological bit, but also building community of practices, bringing experts together, bringing member states together to be able to share information and be able to detect from it in a timely manner. So as you can see on the slide, we have been able to look at other different sources beyond the traditional sources that we currently are utilizing. We are looking at the EIOS, we are looking at tweet decks, we are also looking at blogs and all those. But again, most importantly, we are establishing community of practices within the different regions where countries are able to share information, they're able to cross-verify information, and are able to institutionalize actions promptly towards mitigating them. So, deep diving into epidemic intelligence from open sources. Of course, this is one of the tools, and of course we know EIOS spans beyond just the digital technology, but this is one of the tools that we also have been using to improve early detection and reporting of public health threats in the continent. And as Africa CDC, we've been able to set up a community within several communities within the EIOS initiative. We've also been able to set up teams within our regional offices. And these different teams on this platform are able to share data. They're able to detect and cross-verify data across the different regions, which is also helping member states to understand what is happening, helping the different teams in the different regions to understand what is happening. And this is really critical to global security. We have also developed several bots on the EIOS that helps us to track events that are really relevant to the public health emergency. And also we have most recently, which is really one of the groundbreaking milestones that we've been able to attain, established a collaboration with European CDC, and we now have a joint community where we are able to now start tracking events across the different continents that are really relevant to both institutions. And this is really very key towards improving cross-border and cross-border threats. Then lastly, but also very importantly, we have been able to develop an event management system and link this system to the EIOS platform. This system has helped us to detect over 300 events the past 2 years from 47 EU member states. So, of course, we want to scale, but there are still limitations. The first is the influx of digital solutions with lack of regulatory mechanism. We have developed this event management system, but we intend for it to also be interoperable with other existing tools at the community levels. The communities are detecting, they also have to feed this information, and this information should be able to be seen at the national level by the actors that need to take decision. However, some of these systems are still very fragmented, and there is need to actually harmonize standards and ensure that there is interoperability for seamless data exchange. There's also wide diversity in capacity. I cannot overemphasize this. We know that even within the same country, there is a gap in capacity at different districts. And one of these capacity, I just want to touch on infrastructure capacity. We still know that less than 30% of the African population has access to internet. And without internet, a lot can't happen. So there is still that disparity in access to internet. There's that disparity in the workforce. And so there's really need to look at where these gaps are and see how to bridge that. There's also the lack of trust on digital solutions. We'll be talking about trust all day, so I don't think I really want to emphasize on that for the sake of our online audience. This trust is about those that are intended, the end users not engaged at the very onset of the development of the systems. I just want to touch on that bit. When developing a digital solution, the end users have to be at the very beginning and you have to work with them, carry them through to the end of the development. But if you bring already developed solutions to this experts or to member states that are not engaged in the development process, then definitely will be no trust in the utilization of these solutions. So there's really need to engage stakeholders that are utilizing these systems to improve on trust. There's also the cost factor. We can all attest to the fact that most of the solutions that have been developed at the national level, we also have the districts that really need to use the solutions, but they are not able to have them. Why? Because maybe there were no funds to provide training and cascade and roll them out at those lower levels. So the cost factor is also very, very important and crucial to look into. What should we do? We definitely have to do something. And our recommendation is that collaboration and partnership should be at the center when we're talking about scaling up any digital solution. And when we're talking about collaboration and partnership, we are looking at building epidemic intelligence communities. I think the EIOS stands a very excellent chance of scaling with this collaborative approach to using. However, we need to start breaking down the walls. We have several communities that we are not able to talk to each other. This is open source platform, but we still have so many walls. Then imagine classified information. So as the EIOS community, we really need to start looking around, breaking down some of these walls and engaging each other better if we want to foster data sharing. Also, we need to look at how we can come together, develop initiatives that would help us build capacities for countries, harmonize even our terminologies. I give an example, alert signals. WHO, AFRO is still using alerts. Africa CDC is using signal. WHO headquarters is using alerts. And so we are all providing support to the same member states. We need to sit together, look at how to redefine how we work together, even at the level of harmonizing terminologies, harmonizing our guidelines, our SOPs, and so that we go and speak in the same voice. Lastly, research. Of course, we cannot really overemphasize that there is need for us to look at how we can start generating evidence, especially for tools that have been proven to work, like the EIOS. We can generate evidence. We can look at tools that systems in member states support them in conducting some sort of an monitoring and evaluation, generate that evidence to demonstrate to decision makers that institutionalizing such digital solutions play a tremendous role in the detection, timely detection, which also informs prompt action. Let me end here with this quote: great discoveries and improvements invariably involve the cooperation of many minds. And this is by Alexander Bell. With several minds, you can really do so much. Thank you.
Thank you very much, Mercy, and thank you between you and Dr. Rosen. I think you've issued some challenges to the community that's represented here today in terms of the EIOS initiative. We're going to transition to a panel setting, which means that we're going to start setting up the stage for that. While that is happening, you have to listen to my boring voice for just a few minutes. I don't have another Osiris Isis story for those in the room. For those online, I guess you'll have to ask somebody who's in the room for that story. But I do just want to remind those in the room and those online, the panel is your opportunity to get involved in this discussion, raise some questions. We've already actually received a question, so If that was you, thank you. If it wasn't, think about some questions and engage with us. I think we're all set up. So at this point, I'd like to invite all of the panelists to come up onto the stage.
Well, thank you once again for your presentations. I think one of the things that came out, at least that I noticed, there was a discussion on or inclusion and mention of climate and human mobility. That was repeated again a couple of times in terms of human mobility. Animal mobility was mentioned. People's behavior. All of these factors interact together. And so as we think about how all of these things play a role, I wanted to maybe ask or point the first question before we get into some of the questions from the audience to you, Dr. Kaufman. So you talked about complexity and complexity science and complex systems, particularly in the context of pandemics. There's so much that is interacting together in this world, and you sort of showed a diagram and you talked about some of those things. It can get quite overwhelming. How should we, as a public health intelligence community, engage with others in other domains, and how can technology help us maybe address this complexity from your perspective?
That's a very interesting question because that's a question about communication. And I think there are many answers to this. First, and this, there's solutions on every scale. So I can tell you from my personal experience, I have a team with individuals from very, very many different disciplines. We even have an artist in our team. And that's quite helpful, just to have constant exchange of different perspectives. So that's one element. And I mean, there's always a lot of talk about interdisciplinary research and, getting people together. But I think one solution is to have sustainable interactions between disciplines and between individuals of different disciplines. Like the long-term interaction is very important. It's much more important or much more efficient than getting together every now and then. Because I've seen many programs and events where people come together and then they, go away again and then they do their own thing. But what is essential ingredient is almost, at least from my perspective, not only like an interdisciplinary or transdisciplinary attitude, but almost an anti-disciplinary attitude. And that's what I try to illustrate in the talk with complexity science. It's the intentional, going into environments where you're not the expert. There's a great quote by Richard Feynman, who was also a Nobel Prize winner in physics. And he said, if you're the smartest person in the room, you're in the wrong room. He was trying to convey that you have to seek out environments where you learn more, where everyone is telling you stuff instead of you telling what you know. And so we just have to, I guess, that's generally true, work on infrastructures that make it possible for people to be together for longer periods of time, because that's another element that comes in is trust. So you have to have continuous interactions. The chemistry has to be okay. And then new things can happen. I think that's an essential element.
Thank you. So I think that then maybe raises an interesting question for you, Dr. Rosen, and you as well, Mercy, in terms of how does this look practically at the national level in a Ministry of Health, and then at a regional level in something like Africa CDC, where Mercy, you talked about establishing, collaboration with ECDC, which is great, but that doesn't necessarily extend beyond that public health domain. So maybe, Dr. Rosen, I'll point it to you first. Within that national framework, what's the appetite to engage, across these different domains on a more sustained basis rather than just an occasional interaction to build relationships? Is that already being done? And if If not, what's the appetite there?
I think wherever we are in a small or big country, we need to interact with the others. We need to interact with other countries, with regional levels, with global levels, because in such way we can learn more and we can exchange the experience, and also we can adapt new technologies in our daily life and daily work. So I think we cannot work alone as an island. We need to interact with the others and to have this shared experience, and also to have this another thing to test these new technologies and to try how to translate them and also to scale up them in our daily work.
And I mean, you talked about the different levels. What are across the different domains in terms of, Dirk's a physicist, theoretical physicist. Is there a place for that in, the Ministry of Health, or engaging with that in the Ministry of Health? And what's that appetite? I think that was, trying to get it at that cross domain.
We've taken the example of the pelican. So pelican, this is not health, human health, this is animal health. And also we have other examples. We have the mosquitoes. This is not human health. So usually when you talk about human health, it's not only on humans. You have also the environment of this human. And here you have to consider this environment.
Thank you, Dr. Rosen. Mercy, maybe over to you. It's sort of the same sort of question, but also you talked a little bit about research. So maybe tying that in as well to sort of taking
some of this theoretical maybe research and turning it more into an applied research where you get practical solutions out of it, but engaging across domains. What are your thoughts on that from an Africa CDC regional perspective?
Thank you so much. I think that's really a good question and also a tough one, especially when you're looking at multi-sectorial and looking at engaging different sectors and different actors in the same space. I think one of the very critical areas that we need to focus on, focus our research energy in, is showing a proof of concept, or I'm talking about generating evidence that demonstrates the effectiveness of data sharing using the One Health approach. We have been talking about One Health for the most years. We've really never demonstrated the success of a functional One Health in a particular country. Most often when we're talking about cross-disciplinary information sharing, it's more bringing people in the room and discussing and say we're doing One Health. But in practical sense, we have the animal health, it has its own system, very, very vertical. The human still very vertical, and the environment vertical. And again, just to add, these different sectors are different levels of maturity. We're looking at the human sector, we have standards that really guide the way we collect data and the way we analyze. But if you go to maybe the environmental sector, it is still very lagging behind. And these are some of the challenges that we definitely need evidence to demonstrate that these are the gaps, and this is where we need to focus our investments in.
Thanks, Mercy. So we've heard a little bit about sort of different data sources. One of the questions that has come from the audience, and I think it'd be interesting to hear perspectives from all three of you, is what's the role maybe of the Internet of Things? So this person has actually specifically asked, as an example, wearables. What's the role of information coming from wearables? How usable is that? Where does it fit? And maybe there are other thoughts as well in terms of the broader sensors that are as part of the Internet of Things, or the Internet of Everything. So maybe we can start and go through and see what your thoughts on that are.
I like that question a lot, because in the presentation I was going to talk about the use of wearable data, and I think it's super promising. I mean, we started this like years ago, and like within a week, in the beginning of the pandemic, we were able to recruit 500,000 donors that donate and keep donating their daily information that is collected on wearable devices. And it's a great example of also an interaction with the public, providing data on a voluntary basis, on a participatory basis. Also an example of like reaching a boundary, because we have like an internet blog, etc., where we inform the donors of everything. And that really, really can work very well, because everyone in a crisis, we heard this in the talk about trust today, if you provide all the information, everyone wants to help. It was amazing. In a country like Germany, where everyone is very privacy concerned, we had like within a week 500,000 donors of like 10 million people that have a wearable device. It's a massive amount. It was really surprising, and I think that's really something. And we have just begun to look at, all the information that is hidden in the data in terms of relevant information for health, like long COVID or stress factors, psychological factors, all of that. And so I think that road, having the public participate with their individual smart devices, is going to be one of the big things in the next few years.
Yeah, thank you. And Dr. Rosen, maybe I'll also just preface this by saying that we're going to dive more deeply into this tomorrow for those who are in the room tomorrow morning. But maybe just some preliminary thoughts, Dr. Rosen, is getting information through wearables more of just an academic theoretical exercise, or does it have actual real world applications in public health? And what are your thoughts?
Having more data, so it has a plus and a negative side. The positive side that we can have more information, more knowledge, and how to orient our activities and our response. But the negative side, we have to know how to deal with it. This is a kind of big data, and you have to know how to manage, how to deal with big data. If you don't have the skills, you will not have a good benefit for it. So I think here we have to think that we have also to build our competencies and skills to use this kind of data.
Great, thank you. Mercy, do you have any additional thoughts or comments on that you'd like to make?
I think she really touched on it the way I really was also thinking around, because on the continent, like I said, we need data, and the data is available on the continent. It's available in Africa from our context, but this data is not really being utilized. We don't have the capacity to actually analyze this data and actually generate evidence the way it should. We are generating evidence, but I think it's not optimal there yet. So I think like we have to focus on where are the gaps, where are those missing blocks that we need to really get into and try to fix things. And one of those is looking at where each country is, because it's not a homogeneous, our continent is not homogeneous. We are different levels. So if you're looking at it from a continental perspective, this data is still coming from the country level. Africa CDC is not mine, it's not generating data. Countries generate this data and share with us. So if the countries really don't have the capacity to generate good data, definitely we will not have the data at continental level to analyze. And so it goes back to the area of building capacity, building core competencies that we really feel are missing on the continent. And where do we need to deploy these competencies? Something that we really need to also dig and find out where the gaps are, which countries need what, at what level do they need this capacity? Do we want to look at different sectors that also have a bearing or a stake on the public health decisions that we're making, So do we need to also build capacity across sectors and not only limit to public health? So I think these are some of the critical questions that we need to think around and see how to better improve on the capacity, the analytic capacity, and also the dissemination of this information.
Thank you. That's great, because you both actually raised something that has been asked by a few people, either online or in the audience. I can't tell. And so maybe we'll direct this question to you, Dirk, as somebody who works in this space and who has an interest, as you said, in curricula and training. And so the question is, what are the skills for curriculum building of the next generation of epidemic intelligence officials to deal with complexity? Physics, data design, narrative hackers, arts. What do we need to be looking at, and how do we build this curriculum?
Well, so, I've been asking myself this question a lot, and especially when to start. So I've because I'm also a university teacher, I teach people, and they come to me and want to learn stuff like about complexity or data science or network science or dynamical system science, like I mentioned. And usually all of them are a little bit disappointed that they hadn't, started earlier or had an opportunity to be exposed to this. So I've been trying to push this into schools, because as you said, I used to be a physicist, and physics in school is really boring to many people. It wasn't to me, but to many people it was boring. But there's so many aspects, so much magic about it that you could, do it differently. For instance, by integrating data science, network science, everyone likes looking at networks. I don't know why, but potentially because you see things that you previously, didn't see. So in terms of teaching and training, it has to be to everyone who wants it. And there are many people that want, I've epidemiologists, veterinarians that come to me and they want to learn it. And so I would try to push it to a very early stage, like university level, first semester, basic course, data science, network science, design thinking, have a portfolio of very many things. It doesn't mean that you have to learn all of this, but be exposed to like these puzzle pieces that are intrinsically connective tissue between traditional disciplines. Even if you just take, a course in one of those, it will help you understand people from different areas. So early and a diverse portfolio of things.
Thank you. Dr. Ozen and Mercy, do you have any thoughts on that when you hear that in terms of broadening maybe some of the scope of an exposure?
We are curious, but at the end of the day, you need to perform some competencies at work. So you can start like school. In school, you're exposed to different things. But when you go to the workplace, you are doing one thing and one domain. So when you go to learning of others, so it's more oriented to the skills that will be performed at work of workplace. So this is a big discussion. Do you want to have a big exposure to everything or to be skilled in one domain? I don't have the answer.
This is great. This is the kind of discussion we have about 10 minutes for to answer. Mercy, did you have something you wanted to say to that as well?
I just want to ask that question to the audience. How many universities so far offer a course on complexity science? I know those are some of the things that you learn maybe, advanced, maybe in fellowship programs, or maybe you get you do maybe postdoc programs and stuff. So it's a very, very vital skill set, but how do we expose people to get that kind of capacity or build that kind of knowledge, skill set, maybe even on the job? So as Africa CDC, one of the things that we're trying to do is we're setting up fellowship programs whereby we're starting with bioinformatics at the moment, whereby we open it up to experts on the continent to be able to compete for, get on it, and identify experts from different parts of the world to train them. And I think this is kind of making baby steps towards addressing some of the gaps around analytics and improving on data absorption on the continent. So it might not be critical like a traditional educational process, but we could also bring some of this thing up on the job and build capacity for those that are interested.
So I think, maybe if I were to summarize what I understood from what you said, Eric, is that basically, the way we need to approach this is to have multidisciplinary, interdisciplinary teams where people on the team have expertise in specific domains and just enough exposure to be able to work effectively together across their specific domains. And so maybe that starts to address a little bit part of this conversation of deep and broad, rather than having everybody being able to do everything.
Yeah.
Just a small comment, and you have to go into these teams with the right attitude, and that is always listen to the other perspective. And too many times I've witnessed, rooms full of people with diverse backgrounds, and they've thought that their particular area was the dominant factor of whatever was being discussed. But everyone thought that. So everyone had like this weird, twisted caricature in their head about the phenomenon. And that goes away if you build teams that are very fluid, where you go in and you listen more than you speak. And, you put what you have on the table, but you also look at what the others bring.
I think that's something very important for us to keep in mind with the hub, because this is exactly part of what we're trying to do if we're talking about collaboration. So, whether you're a physicist in the audience, theoretical or not, or something else, I think we need to work together and exactly have that sort of attitude, and then bring together the public health domain as an integral part of that. There's another question from the audience that I thought is interesting. And I think this is again for you. If pandemics are complex, does that mean they are impossible to predict?
Huh. Good question. So yes and no. There are aspects of it that are very predictable and aspects that aren't. Just like you have in every feedback system that has many moving parts in it, and they influence one another, you can have aspects that you can predict and others that you cannot predict. For instance, if you look at COVID and you monitor like the basic reproduction rate for many countries, you'll see, all the waves look different in different countries, different timing, but the R value always oscillates around 1. That's a universal feature, almost. It's almost universal. The way it wiggles around 1 is predictable in a sense, because it's a balance between our response and and letting go of the response, and it's kind of equilibrating at a critical value. So that's a prediction that a very simple model would make. It doesn't help much, but it is a prediction. And so there are aspects of it that you can predict and others that you cannot predict, that are more like a rolling a die, that no matter what you do, you're not going to be able to predict it, no matter how big your computer.
So maybe just moving on from, thank you for that response. And I welcome any follow-up on that from anybody in the audience. But maybe to just direct a question now to Dr. Rosen and Mercy, also a question from the audience. We've been talking about leveraging innovations and technology. Both of you talked about EIOS and the EIOS system and how you're using it. We've heard about complexity and the need to go, beyond just our domain. Sort of thinking about all of this, and also the answer we just heard around prediction or forecasting. What is the one, if you had one improvement that you would want to see in EIOS in terms of technology, in terms of the system, what would that be?
From my experience, I would like to find an engine where I can search the social media, because I'm catching more alerts by reading manually the social media than reading screening with EIOS. So, and we are facing this in daily manner. So the idea is to have an engine where we can, in an automatic way, screen the social media in a daily way with an easy manner.
Thank you. And Mercy?
I have 2 things.
Just one.
Okay, I'll address it from the continental perspective. And looking at the regional the wars that that stream out different. We still want to retain our communities, but we still want to feel like this is a global community. At this point on EIOS now, we're still limited to the fragmented communities where we are able to just interact within the communities as institutions. But what if 2 institutions like Africa CDC and European CDC want to see and interact and cross pin events? And that is what we came to a conclusion we wanted to do, but that was not possible. So I think these are some of the collaborative mechanisms that should be created on the platform, and we should give that opportunity for information sharing on that platform. I think it should start within us as an EIOS community, and then we can now start pushing this to member states. But if, as EIOS, we are not able to do this, then it's even very, very difficult to tell member states to collaborate. So we should break some of those walls, expand and allow different communities within the platform to
interact and share information.
Thank you, Mercy. And, we're going to have a session on day 3 where you'll be able to ask the EIOS team any question you want. So bring your suggestions, requests, etc. That goes to the audience as well, and we'll try to address or at least talk about some of these things. Final question before we end this 3rd speaker series session. And in the context in which we are working, I think this is a good way to end the series. And the question, again, from somebody from the audience is, how do we better translate data from a complex network into real-world actionable information for decision-making during a rapidly evolving event? I think that's for you, Derek.
I was worried. Well, that is always a challenge, but part of the agenda always. Actually, in this question, network appeared, and in fact, network science as a science is predominantly about the transportation of information. So we see it's just almost like a microscope. Like a microscope was an instrument that made things visible, and it changed science, just like a telescope. So we had like 2 instruments that revolutionized science just by making things visible. You weren't testing any hypotheses, you weren't looking for evidence, you were exploring new things by making things visible. And network science is a little bit like that. So there's part of that question is also the answer, that often you have data sets that are very convoluted and complicated, but they have a network aspect. And you can just write down a table like you usually do, or you can visualize the connectivity in the data as a network. And you can turn it and twist it and try different visualizations. And then immediately, sometimes you will see things. And that could be not just evidence for something, but it actually helps developing an intuition about the system. And that's, I think, very essential for emergency situations where you don't have time to produce the evidence to make the perfect decision in a response. But you have to very quickly develop an intuition of what is happening. And network science is actually quite good. We use it in the global mobility situation quite well, just to form an intuition of, what if the outbreak is here? What does that mean to other places? It's not even about predictions. It's about developing a good intuition, a good right feeling about the situation. And that is, I think, the greatest benefit of network science that I've seen in the past 20 years.
Thank you very much. Dirk, Nada, Mercy. Just want to say a really big thank you for being here with us in Luxor at our speaker series, our 3rd one. Thank you to everybody in the audience. I know it's late for those who are in the room after a long day here at the EIOS Global Technical Meeting. For those who are online, thank you for tuning in. And with that, I just close this speaker session, the 3rd speaker session, our final one for the year. Thank you again, everybody. I hope you enjoyed our discussion, and stick around for those who are here for the reception, where you can ask more challenging questions of our panelists and also of each other. Thank you very much once again. Have a wonderful night. And for those here, see you tomorrow.